Namaste and good afternoon. A warm welcome to each one of you on this gorgeous sunny afternoon in our great city of Houston. My name is Manish Wani, and by trade I'm an otolaryngologist, head and neck surgeon. I practice out in West Houston, but today I'm truly honored to be your MC for this auspicious event. So we have an amazing lineup of speakers and topics this afternoon as we collectively come together to discuss one of the most pressing and important topics of our time, mental health. And to be respectful of everyone's time, we will do our best to stick to this timeline. I actually have a bell, so the speaker may get a 2-minute warning with the bell, but we're going to try to stick to the timeline. So Reach Mental Wellness, RMW, as you saw on the website, is a nonprofit organization, and it addresses the mental health needs of the Indo-American community in our great city of Houston. And to give us further insight into Reach, and really one of the biggest reasons we're all here together in this successful program and I'd like to introduce one of the founding members and a board member, Ms. Alpa Shah, to give us more insights on Reach.
Thank you, Dr. Rani, for that introduction. Good afternoon, each and everyone. On behalf of the board of Reach Mental Wellness, I welcome and thank you for coming at the launch today of Reach. Reach is a grassroots organization that started in January of 2024. After a couple of tragedies that happened in our community, some of us felt that something has to be done to address mental wellness in the Indo-American community, and that's how Reach was formed. The name Reach derived from resources, education, awareness, community, and health. These are the pillars of our mission. Our mission is to create awareness for and support mental wellness in the Indo-American community by providing the network of resources which are available to them. Mental health is as important as physical health. According to the US Department Health Survey, 1 in 5 Americans suffer from mental illnesses and mental health challenges during the course of their life. But surprisingly, less than 40% seek the treatment. And the reason is the barriers like logistics, lack of awareness, and above all, stigma. So these are the reasons people do not seek treatment. Reach is aiming to break that barrier and educate our community about the choices and the resources that are available in our community as well as outside the community where they can seek help. Nobody should struggle alone. There are choices, there is a help, and that is the whole idea of Reach to get together and open the dialogues. Now there are many organizations have started giving lectures and talks and everything, but Reach feels that we have to go beyond that and help the community by extending the hand for helping the individuals. So how we go about it? So our first presentation, first of all, we have to educate the community so that they know what is awareness about mental illnesses. Our first presentation was at Arya Samaj in the April of 2024. And the topic was, is mental illness stigmatized? The lecture was given by Dr. Renu Thomas, who is present today amongst us. And after that, we went to health fairs and we went to the community gatherings and started educating people, because education is the power we can give to them to change their course of life. But we found out that there was overwhelming response for this subject. So we thought just giving lectures is not sufficient. We had to find a solution. So we did a feasibility study, we did the survey to get the pulse of the community, whether they need Reach or not. We also talked with psychiatrists and psychologists to how to navigate this organization so that it can help people in a better way. And then, after doing all this compiling of the survey, we found out that we have to develop the directory of providers that can help the people. And we did a culturally tuned directory, culturally tuned professionals that are in our directory of providers. So here we are, that compiling all this information and also getting our 501c3 and non-profit organization badge. Here we are to present a package to you, to work with you, to get into your organizations for just one goal, is that let's make more healthier and better understanding community. I will come a little later to tell you how we can reach out to you, as well as what we have done in the past, as well as how we are going marching forward in our journey. And I really hope that you will support us in this beautiful cause. Thank you so much.
Thank you, Lovaman. Congratulations on your grassroots efforts in getting this program going. It's such a much needed thing for our community, so thank you. Well, we're going to start the program. We have, like I said, many bright and intellectual speakers, but our first speaker for this afternoon is Dr. Devika Srivastava. She is a licensed psychologist in private practice in Houston, Texas, and she specializes in mental health issues affecting South Asian Americans and communities of color. She earned her BS from the University of Houston, pursued MS work at Columbia University, and received her PhD from Fordham University. She has held several influential positions locally, and also was the chair of the division of the South Asian Americans the chair of the division on South Asian Americans for several years. She is a prolific researcher and speaker, and is a co-editor of the first book on South Asian American psychology. Please welcome Dr. Devika Srivastava.
I'm a little short. I don't know if this will, if you can't hear me, let me. Thank you. Hi, everyone. It is an absolute honor to be able to join you today and join with REACH to speak on South Asian American mental health. We have many issues in our South Asian American community that are unique to our culture and our identity. I'm a psychologist that owns a national practice that focuses on intergenerational South Asian Americans in the diaspora. And I work with individuals, couples, and families. I want to tell you a little bit about my clinical work and my research on South Asian American mental health, and also the responsibility that all of us carry to help ourselves, our family, and our community. So, first and foremost, it's extremely important to understand the pertinent issues unique to our population. South Asian Americans are one of the fastest growing immigrating groups in the United States, according to the last census. 1 in 5 South Asian Americans will experience anxiety or a mood disorder. We as South Asian Americans also tend to somaticize our psychological symptoms, meaning they come up as physical complaints, often GI issues or pain. Unfortunately, we also have a higher lifetime rate of suicidal thoughts compared to the US general population, with college age and older South Asian American women above the age of 65 being the most risk. However, mental health struggles impact everyone. I've seen children who feel misunderstood due to a cultural differences, meaning when you move to a different country and you're socialized different in that home country, you have a blend of individual and collectivistic differences. Values are different from your parents, from your grandparents, so that becomes an issue. Additionally, parental expectations. I also see so many individuals, South Asian individuals, that don't know how to identify or express their emotions, and they bottle it up until it comes out all of a sudden, or it manifests as physical symptoms. I also see couples navigating discord due to multiple roles or family patterns, in addition to LGBTQ LGBTQIA+ individuals facing estrangement from their families, or women who believe that their worth comes from sacrifice or productivity. I see a number of individuals that feel that they're caught between two cultures, or even third gen, so, kids that are raised here, their children, that feel that they have to have anxiety because they don't have the same challenges or sacrifices as their parents. I often work with mother-daughters, siblings, interracial couples, families grappling with all of these cultural complexities. And these challenges often manifest as depression, anxiety, self-harm, suicidality, identity issues, and problems with attention or other behavioral symptoms that we just can't figure out why. Coping is something that we really need to address. So, just to highlight, anxiety and depressive symptoms are normal emotions. If we have a bad day or something happens and we're a little bit sad, or case in point, there's a dangerous situation. Anxiety and stress are indicator lights, right? A bear's coming for us, we have to run. Normal emotion. Or maybe if somebody dies, it's natural to feel sad. What is the difference, though, is how chronic, how prolonged, how intense that feeling is, and how we cope with it to reduce that distress, to change that feeling. Do we drink? Do we work out? Do we talk to friends? Do we put our anger on others? Do we look at our phone for hours? Or do we get the support and treatment that we need? Often individuals feel hopeless, that there's no answer or solution, but through support, it changes the way that we think, our behavior, and we begin to feel better. It's also critical to understand that mental health issues are not isolated to just that individual. They're influenced by the family and the community systems that we live in. If a child is struggling, it might not be about school or friends. We have to ask ourselves, are there patterns in our family that might be contributing to this, or modeled or carried down? And they might not work because of those acculturative differences, differences in values, or even generational differences. Maybe those patterns never work. Maybe we've had anxiety and we carry it down to our kids. By addressing these issues, we can connect better with each other and promote well-being, removing some of that psychological distress. We also need to break the cycle. We need to understand our family dynamics better. I see so many children, adults, and even older South Asian Americans who grew up feeling that they had to earn love through grades, career choice, or relationships that aligned with their family expectations. They're often compared to others in community, and this might be a means by their parents to motivate, but often it depreciates and creates a lack of acceptance for who they are. Leads to anxiety, depression, and also a deep-seated feeling that they're not good enough. Our self-worth often becomes then tied to our productivity or sacrifice, and this becomes a pattern carried down through generations. Additionally, parents sometimes reinforce this using shame, guilt, or fear, or even punishment, because they feel if their kids don't meet those expectations, they're not going to be happy, they're not going to be successful. And even though these intentions might come from a place of love, it can have lasting consequences. I see many South Asian Americans that are in their 30s, their 40s, even their 50s, and they feel unfulfilled in their careers, in their relationships, in their interests, because often they've pursued these things to please their parents or according to their parents' values, and now they're struggling with anxiety or depression, and they don't know themselves. They don't have that good sense of self, and can only see themselves through how other people see them rather than themselves. We also need to understand that we are of the diaspora, meaning that our kids are raised here and their kids are raised here. We need to listen and understand each other to foster better relationships. What we need to do is to shift the mindset by prioritizing connection over compliance. Are we creating space for our children to express themselves authentically? Are we fostering sibling relationships that aren't rooted in comparison? These intentional conversations can lead to stronger, more empathetic family bonds. Dating and intimate relationships are also one of the biggest sources of conflict in South Asian American individuals and families. You know, dating for South Asian adolescents and adults are different compared to any other group in the United States because often they feel that they must hide their relationships from their parents due to lack of acceptance. It becomes even more complicated when they're in an interracial relationship or with a member of a different religion, caste, or class. This becomes even worse if somebody is LGBTQIA+, where they know that their gender identity or their sexual orientation won't be accepted or even punished by their family. And this causes a lot of other problems. Unfortunately, these issues are very common for a lot of the clients I see, and they cause an overwhelming sense of anxiety, depressive symptoms, and rifts in relationships. Open conversation about these topics and the willingness to change views and actually accept one another is critical in maintaining well-being for the individual and the family. Stigma, I know it was talked about just now, is South Asian Americans have greater stigma towards mental illness and issues more than any other group in the United States. And this is a major barrier for individuals to obtain support and treatment. South Asian Americans, youth often will express that their parents are worried about what will others say, look, gay. Many South Asians believe that mental health issues don't happen to us, or if you go to a therapist, you're plugged like you're crazy. Others fear that it will, and are also told that if they go, it will shame the family. As a result, so many people suffer in silence and allow their struggles to escalate until there is a crisis. The truth is, therapy isn't just for crisis situations. The sooner you get help, the sooner you understand yourself better, the situation, and you can change things and improve. Mental health is not a Western concept, it's universal. And a competent mental health provider will integrate your culture, your worldview, your religion, your spirituality into your healing journey or any kind of treatment. And, you know, as the family changes and becomes more open, connected, and communication becomes more healthier, they'll become a source of support, but sometimes even then the individual might need more support and help. And what we need to do is accept that this is okay, this is needed, and that this person is exerting strength to improve themselves and the whole family. Now to the solutions. What do we do? Number one, we have to end the stigma. Getting therapy is a sign of strength, not weakness. This person, just by getting help, just by calling, is wanting to improve themselves and the system in which they live and the community that we're all part of. We need to normalize seeking help and talking about mental health in families and in our entire Indian community. We need to also talk about our own struggles. The more we talk about it, the more we know that we are not alone, and that helps our progress and their progress in getting better. Number two, we need to integrate the family in the healing process. Psychoeducation, helping families understand information about mental health. We need to learn how to communicate in a more healthy and effective manner, depending on the acculturated and generational differences, to understand and respect those differences, and how to also support one another with other stressors like discrimination or things that we face in our outside world. We also need to learn about mental health treatment. Medication is recommended when symptoms are distressing, uncontrollable, if there's a pathogenic cause. But therapy is what will change your thoughts, which enable us to see ourselves, relationships, stressors, and our situations differently, or even change it. It empowers us, and it enables a long-term solution. We also need to create safe spaces and intentional conversations. We need to allow family members and community members to talk about struggles, emotions, but also make the request. We need to express our needs from one another. We need to accept the whole individual to remove unrealistic or misaligned expectations that are causing distress. and to understand those identity and cultural differences and undo those maladaptive intergenerational patterns to create healthier new ones. We additionally need to address power differences in our relationships, whether it comes to gender, multiple roles, to develop healthier ways to respect in one another as well. Number three, we need to leverage community resources. Mental health providers and religious and cultural organizations need to collaborate. Temples, mosques, Gurdwaras, South Asian American organizations, we need to all create a platform to normalize talking about emotions, mental health, our identity, all of these struggles that often many in our community go through. Connection and communication leads to change. The most important message I want to leave you with is that understanding brings hope and change. By recognizing when we connect and communicate in an effective, non-hierarchical manner, we broaden our thinking and we can foster those open conversations where we can discuss mental health challenges with compassion and understanding rather than rigidity and judgment. We can create a community where everyone feels seen, valued, and supported. I want to thank all of you for allowing me to speak with you today. I'm available afterward for any questions or conversations, and they have my information, and you can get my information if you need. But thank you so much for being here today and trying to help our community.
Dr. Shiva, in appreciation of your amazing speech, please accept the plaque as a token of Regis appreciation.
And a quick fun fact, DOSA is now spelled D-O-S-A-A. And I will ask you in the quiz what that stands for.
It stands for middle.
Yeah, thank you so much. That was amazing. Connection over compliance, connection and communication. I mean, those are amazing words of wisdom. Thank you. Okay, it's truly my pleasure to introduce our next speaker. Her name is Anaga Surendran. She is a youth ambassador for REACH. She was born in 2006 in New Delhi. She moved to Houston with her family at the young age of 2. Her mother, Suba, is a dedicated nurse. Her father, Judge Surendran, they've worked diligently to provide her and her sister Sandra with endless opportunities here. Anaga is currently a freshman at the University of Texas at San Antonio. She's majoring in communication, but she does plan to follow in her father's footsteps and attend law school. And beyond academics, Anaga finds joy in running, playing with her beloved dog Buddy, reading, writing, and cherishing moments with her family. Please join me in welcoming Anaga as she shares her experience in facing mental health challenges.
As a child, I aspired to be someone great. I had no doubt in my mind that I would achieve incredible things in the future. It was only a matter of time. One of my favorite childhood memories are of my parents standing proudly in the audience as I was holding an award, smiling as they tried to take as many pictures as possible. Afterwards, telling me how proud they were of me. I started playing the violin in 4th grade, and I eventually excelled into a varsity orchestra pit. I also ran track in high school and made it to the Junior Olympics in 2021 for the 4x800 meter relay. I was an honor student, taking advanced classes throughout my school years. My life was steadily going uphill, and I thought life could only get better. But my life took a drastic turn. It would take me so long to get ready every morning before school because I needed to get everything to be perfect before I left my home. I had to clean my room, my shoes, my backpack, my phone, and make sure that I too was completely perfect in every way. I know it sounds irrational, but these were the thoughts that would go through my head, and I could not control my mind, as my mind was controlling me. I would get up in the middle of the night and pray 8 times, and if I had a negative thought in the middle of those prayers, I would redo it. I had to enter every room with my right foot, or else I'd have to walk out and do it again. Sometimes I'd feel as though whatever I touched was contaminated, so I'd clean it immediately. It was exhausting, but I felt as though I had to do these things because my mind would tell me that if I didn't do certain things in a certain manner, something bad would happen. I believed I had obsessive-compulsive disorder, but I didn't know how to explain this to my parents. I feared they would think I was crazy or making things up, but they believed me, and their only concern was my recovery. My mom found a team of doctors at Baylor Medical Center who specialized in treating OCD. And from there, I was officially diagnosed with OCD in 2021. Progress was never linear, and I felt that recovery was unimaginable. I had to miss school several times a week for doctor's appointments. My dad would sacrifice his time and well-being, driving me an hour there and back, attending treatments with me, and taking advice and instructions from the doctors to help me get better. My dad was working hard with his campaign to become a judge at this time, all while trying his hardest to keep his daughter alive. I started getting to school late every single day. My grades started slipping since I wasn't attending class, and I eventually had to stop orchestra. I was disappointed that I was letting one of my passions go, but I still held on to track. Though I was late to school every day, I was always motivated to go no matter what because I had track to look forward to. Track was my last period of the day, so sometimes I would have to skip practice in order to go to Baylor. My coaches had told me they see great things in my future. I focused on improvement and doing the best I could do to make myself proud. But soon my coaches had no choice but to let me go because of my failing grades. They were not allowed to let me compete if I was not passing. I remember crying in the locker room and going home and crying some more. I never told my coaches or teammates what I was dealing with, so I didn't know how to explain my failing grades. My coaches and friends in school often thought I was just skipping class or lazy. I didn't know how to tell them I was suffering mentally, and I didn't think they would take me seriously. Eventually, I stopped dreaming. I let go of track, and at this point, I didn't even want to go to school. I was admitted into a mental hospital in April of 2022 for suicidal thoughts. I was so confused on where my life was headed and how I even got to this point. My parents fought so hard for me, and it was with their help as well as my teachers in school that I passed 10th grade. 11th grade came, and I told myself that I would go to school every day and that I wouldn't let my parents worry about me like they had the previous year. But what I wanted did not happen. I was on the brink of failing once again, and once again, with the help of my parents, teachers, and counselors, I got through 11th grade. I had been taking large doses of pills to treat my OCD, and this would often make me extremely tired to where I couldn't even get up from bed. When senior year arrived, I decided to stop medication because I wanted to see if it would make a difference. I had to be focused this year, as I had to start applying for colleges, and I had to graduate at the end of the school year. That was the big goal. But by the first semester, I was struggling again. My father let my teachers know once again what I was going through. I worked extremely hard to pass the first semester and apply to colleges on time. My second semester of senior year was the worst semester in all of my high school years. I was absent at one point for 3 months consecutively, but at this point, my counselor and teachers weren't certain about my graduation. My father fought extremely hard to help me with mental health accommodations. My second semester of high school was when I decided to get back on medication. My dad would cry every morning, asking God why it had to be me, begging me to get up and telling me that he didn't want to see me fail. I had gotten accepted to colleges, but I knew that I couldn't attend it if I didn't graduate high school. My graduation was uncertain until the very last day of high school, but I had worked so hard, and thankfully, I was cleared at the very last minute to graduate. I was so proud of myself. I just wanted my parents to be proud of me too. I wanted them to be smiling in the audience like when I was a child as I walked the stage. My father would always tell his friends and almost everybody he met with how brilliant his daughters are. He still does, and he tells me and my sister almost every day as well. My parents' open-mindedness to learn, their advocacy, and their continued fight to help me recover is the reason I'm still here today. In Indian culture, mental illness is often thought of as taboo, but my parents believed in me and supported me from the beginning. They did everything they could to get me all the support and resources I need, without even worrying about their own well-being. OCD is something that has affected not only my life, but the lives of my family as well. Though I've lost a lot, I gained so much strength and bravery. I've overcome every obstacle that's come my way, and I've learned to be calm and patient in any situation. I learned that there's so much more beauty and order within chaos rather than perfection. And now, as I'm on the continuous road to recovery, I know that mental health resources like Reach Mental Wellness can help people like me who struggle with mental health challenges. Reach creates awareness and educates the community regarding mental health. They share resources that are available with the community, which can make a significant difference for those dealing with mental health issues. The access to such resources is not just important for me, but for others who face similar challenges. Everyone deserves the opportunity to get the help they need, and Reach Mental Wellness is helping provide that support for people who need it most. I'm currently in my first year of college, and I dream of becoming a lawyer one day. I'm still learning how to live with this illness, but I know that everything will be okay in the end. Something I always tell myself in times of self-doubt is to turn the page. Turn the page and do better today than what you did yesterday. You can't wait until life isn't hard anymore to start being happy. Thank you.
Behind every amazing child is an amazing set of parents. On behalf of me, it's my great honor and distinct privilege to present this plaque to Anaga, but at the same time it's a tribute to her parents, Surendran and Subha.
Thank you, Anaga. That was an amazing story, and it takes a lot of courage to come up here and share that. And we really appreciate you sharing your story. Well, it is an honor to introduce our next speaker, Judge Lori Chambers Gray. She is the presiding judge of the 262nd Criminal District Court located in Harris County. She was elected in 2018. Judge Gray also serves as chair of the Harris County Treatment Courts Committee and the Judicial Education Committee, and is co-presiding judge of the Harris County Competency Restoration Mental Health Docket. Prior to assuming the bench, she was a trial attorney and has 29 years of experience representing clients in litigation in both state and federal court. She's a native Houstonian. She received her Bachelor of Arts degree from the University of North Texas, a Master's of Arts degree from Texas Southern University, and her Doctor of Jurisprudence from the South Texas College of Law. Please welcome Judge Lori Chambers Gray.
Good afternoon, everyone. Thank you so much for inviting me. What a beautiful story, truth, and really touched my heart. So to Anada, thank you for sharing. You didn't have to do that, but you did. To reach perfect name, resources, education, community, that's what these courts are about. But for me, my journey was defending people in the criminal justice system for 29 years before I became the presiding judge of the 262nd in November 2018. And what I learned was many of my clients were suffering from mental illness, and they didn't know how to describe why they did what they did. They had never been evaluated. They did not have resources. And the first time that they were diagnosed was when they were arrested for crimes in the Harris County Jail and jails across the state. So it was my honor when I was elected to immediately move to the mental health docket, because I knew what happened when a person understood why they were suffering and that there were ways in which to live full, productive lives if they only had access to treatment. And what you will do here at REACH is touch millions of people, thousands, because you'll touch those who need the help and then those in their lives. And imagine what our world will look like because you decided to make a statement. So in Harris County, not only do I preside over the 262nd, which is a felony criminal court. I hear cases where persons are charged with anywhere from a state jail felony to capital murder. And what happens in the courts when a person is found to be incompetent, the whole process stops because at that moment, they don't have what we would define the ability to participate in the process. And so those cases would move over to a competency restoration docket. And in that docket, they are restored, they are directed to a full team of professionals who will guide them, and then they will return back to the courts. Now, a lot of people might think, what are treatment courts? Is that just a way to avoid some responsibility for crimes that people are committing? But I'd like to tell you that is definitely not the case. The treatment courts in Harris County were actually established in 2009. They're problem-solving courts because the courts understood when the process stops and you have someone in the Harris County Jail, they cannot remain there. There has to be an exit plan. So what are the solutions? So treatment courts are not ways to avoid responsibility, but a means to understand and treat individuals in the appropriate case. And then once they're restored, they go back and are held accountable for what, if any, crimes that may have been committed. So when we talk about mental illness, and I know many of you are professionals, and I'm honored to just talk to and hear you talk about your practices and your training and so forth. But for those of us who did not necessarily come from that background, and many people that I will encounter will be mothers, fathers, sisters, and they don't understand what's wrong with their loved one. So when we talk about mental illness, we're talking about a wide range of conditions that affect mood, that affect thinking and behavior. So mental illness can also cause significant distress, impairment, and just make a person feel that they can't move about their day. But we understand that it's a medical condition, and it's treatable with therapy, with medication, and lifestyle changes. It's estimated that over 400,000 people live with mental illness in Harris County. So I have 5 things that I want to share with you before I leave. You may want to ask, what are the resources available to people suffering from mental illness? In Harris County, we have the Harris Center, which is the largest mental health and developmental disability care center in Texas. The Harris Center is located also, one of its satellite offices inside the Harris County Jail. So when a person is coming in and processing, they're also being assessed at the very moment that they come into the system. They have 4 locations in Harris County, They provide medication, they provide therapy, treatment, and wraparound services, which could include employment, housing, and so forth. So how can people access these resources? Well, you can call. You can call the Harris Center, you can make an appointment, or you can actually just walk in. 4, who should parents call if they suspect that their child is suffering with a mental illness or a crisis? What can they do? Well, there is a number that we have, and this works. I know we're in Fort Bend County, but this number works, and it's 713-970-7000. It's a 24-hour crisis line. And there are people I've actually walked in and watched mining these phone lines. They will talk to whomever's calling in, and they will guide you to the resources, because the last thing you want to do is call the police when you need a doctor, and they'll help you move through that. What can parents do? Take care of your child. Observe when things change. Find the medical professional and keep copious notes. And why is that? The treatment, the notes will do a lot of things in terms of leave a roadmap for the continuity of care. And if for some reason a person lands in the criminal justice system, we hope that they don't, but if they do, that information could mean the difference between the outcome in the case. And that's called mitigating circumstances. And so you want to understand if someone, not for an excuse, but for an explanation of what's happening, and if they actually have the mental culpability to do what they are accused of doing. So those records are crucial. So why is it important to understand and treat mental illness? I'll agree and lastly say it helps to reduce the stigma. It encourages those who are struggling to seek support. And it tells us all that it's a medical condition. It's not a character flaw. And it can affect your overall relationship, how you relate to your loved ones, your societal contribution. The most important thing for us to understand, though, that mental illness is manageable, it's treatable, and the courts are doing what we can to understand that, to try to address it in ways that may not have been done so before. We remain open and ready to collaborate with those in our community who understands how important this is to all of us. So thank you again.
Thanks again, Judge. And Houston's so lucky to have someone on the bench like you who really understands mental health and can bring the empathy and the compassion that a lot of these people need in our community. All right, we'll move on to our next speaker. Is Dr. Prashant Gujwani. He's a highly respected, board-certified psychiatrist. He holds both a medical degree and advanced certification in psychiatry. He has over 25 years of experience and has been successfully treating a wide range of mental health conditions, including mood disorders, anxiety, depression, and bipolar. He's also skilled in cutting-edge treatments such as TMS, which stands for transcranial magnetic stimulation, and intranasal ketamine therapy. He offers these solutions for treatment-resistant cases. He has contributed significantly to psychiatric research and has presented at national conferences and published in peer-reviewed journals. He now actually joins REACH as an advisory board member to serve the Indo-American community. So please welcome Dr. Goswami.
Thank you, Dr. Wani. It's a great pleasure to be here. First and foremost, I think we should give a big applause to the founders of REACH. It's an amazing group of very effective individuals that have compassion in their heart, care in their heart, and are ready to open their wallets and their time and created such a beautiful organization by which we are all here to partake in it. I'm really honored to be here. I'm really honored to be part of this organization. You heard enough about mental illnesses and the statistical number. It affects a lot of people, right? But what is mental illness? What causes mental illness? That's the question I grapple with on a daily basis when I see patients. Is it genetics? Yes, genetics plays a little bit of a role. Is it environment, right? Is there anybody in this room who hasn't gone through hardship in life? A heartbreak, some people go through divorces, loss of job, financial issues, kids issues, etc., right? Everybody goes through hardships. A lot of people come out of it, a lot of people are not able to come out of it, whether it's a combination of genetics and environment that causes mental illness, or just the environment itself. But the only tip I have for everybody to take home today is have some type of good coping mechanism that works for you, all right? Whether that's going to the gym, whether it's going to your religious organization, temple or a mosque to pray, whether that's meditation, whether that's singing with your friends, whether that's talking with your friends, whether that's going out in the nature, but have some kind of good coping mechanism that works for you. Personally, for me, gardening is the one that does the trick. I was in my yard today, such a beautiful day, I completely lost touch of time until the alarm rang and said 15 minutes to go. I said, oh my God, run. Mental illnesses are real. Suicide is a real phenomenon that affects us all in the community. There are about 18,000, 19,000 homicides that happen in the US every year. Every time there's a homicide, we hear about it, whether it's radio, TV, there's a lot of coverage. But suicides, I gave you an anchor point about 18,000, 19,000 homicides. Suicides is twice or more. About 40 to 45,000 people are killing themselves in America every year. All right? Suicide is a real phenomenon. I'm not saying all 100% of suicide are related to mental illnesses, but 90% of the suicides are related to mental illnesses. 10% of the suicides are usually random because I went through a difficult time, because my heart was broken, because I got fired, because I lost all the money in the stock market, I lose the ability to live. And we live in a state that is very friendly to firearms, so it becomes a very volatile combination. If somebody is depressed, they have alcohol and gun available, then it becomes a very, very difficult combination. I think it's very important for us to reach out to people, and I see this every day. You know, some people ask me, is mental illness overdiagnosed or underdiagnosed? And I tell them it's both ways. I see it on an everyday basis, right? There are people who should have sought help 20 years ago but did not seek help and continue to suffer, and they thought they can eat better, they can meditate, they can sleep better, and they will get better. Usually mental illnesses, you can't will it away. It's not your fault, you didn't cause it, and you can't will it away. And it requires treatment by professionals. So I think encouraging people to seek help in the right time is the most important part. And I'm hoping to achieve that through the REACH program now. And if anybody has any ideas, or you see in the community where there might be need for REACH to come and give any educational programs, any services that we can offer in the community at any corner that you see that is dark and that needs some light shedding, we are happy to come and do that. We are happy to take the challenge on and help the community wherever it's needed and whatever we can do. So thank you everybody for coming on a Sunday afternoon.
Thank you, Dr. All right. So we have our next esteemed speaker is Dr. Asim Shah. He holds the Barbara and Corbin J. Robertson Jr. Chair in Psychiatry. He's Executive Vice Chair and Professor of Psychiatry, Family and Community Medicine at Baylor College of Medicine. He's also currently the Board Chair for Mental Health America of Greater Houston and Houston Recovery Center. And this is a position that's actually appointed by the mayor of Houston. He's had over 200 peer-reviewed publications and chapters to his credit and authored 2 books. He is a Distinguished Life Fellow of American Psychiatric Association and a Fellow of Royal College of Physicians, Edinburgh. He received the prestigious Ima Hogg Award a few years ago from Mental Health America and is widely presented both nationally and internationally. Please welcome Dr. Asim Shah.
Thank you. First of all, it's an honor to be here. And I'd like to congratulate all the organizers and the people who established this, and especially the people who invited me. It's good to be back with Devika and Prashant. I know them for a while. So, the thing about being one of the last speakers is that everything has already been talked about. So it's either easy or it's very difficult. So either or, whichever you want to go. There were many things which were, I was writing some notes, there were many things which were talked about, which I would like to talk a little bit more about. So one thing which was mentioned was stigma. And whenever we talk about mental illness, we talk about stigma. And something which we fail to address is the word mental has a stigma in itself. So we keep calling it mental illness, mental illness, mental illness, and we will continue to live it as a stigma. So either we need to change the name to psychiatric illness, behavioral illness, something else, but when we call it mental illness, how comfortable people will feel saying, hey, my daughter has mental illness, or my son has mental illness, or my so-and-so has mental illness. Not necessarily that comfortable. So even the word itself has stigma in it. So if we change the name to, it's a little bit more acceptable saying I'm going to see a psychiatrist as opposed to say I have mental illness. So even the word has stigma in it. Then a lot of other things were mentioned. We are, of course, in Fort Bend County. So we talk about resources. Texana is another resource, which is equivalent to Harris Center in Fort Bend County. And we come to resources a little later. We're talking about Indo-Americans, so sort of Southeast Asians, and Southeast Asians are like 8 countries, sort of 8 religions. Does anybody know how many languages or dialects in that area are spoken? How many languages? 121 languages. Right? And how many dialects? 19,500 dialects. Why do I say that? The reason I say that is that in our field, the most important thing is to connect with the patient. And it is much easier to connect with a patient when you can either speak their language, know their culture, know their religion necessarily, or know their day-to-day things. And when you're talking about 121 languages, or even India has 22 official languages. So if you're talking about so many languages, so many dialects, so many cultures, so many religions, you need to have a vast majority of people who understand all these things. And do we have them? Perhaps we have a lot of psychiatrists, yes. MDs, yes. When it comes to therapists, we have only very few. Devika is one of them, so yes, clapping for her, absolutely. So she chose to be one of them, absolutely. But truly we don't, right? We don't have a lot of them. They can be counted on fingers. Because I'm one of those people that if somebody is anxious, somebody is depressed, somebody has obsession, trauma or something, the first thing would be therapy, as opposed to just pushing the pills. That can only happen if we have culturally sensitive therapy available. So that's the first need. When we were exchanging emails, that's the first thing I mentioned, even with your radio program, which by the way you did an amazing job, that we need to have a culturally sensitive directory of therapists so that people feel comfortable. And while the new generation speak English, perhaps the old generation may not speak that good of an English. They may speak their local language. So absolutely that is important and needed. Another thing which is good though is that Indian population is on the higher median income range, right? So we can afford things, which is good. Does anybody know what is the median income range of Indian population in this country? 138, which is pretty good. And actually, Fort Bend is even more. So that is good. That means that most of these people would have insurance, would have resources. But we should also think about people who don't have insurances. So if you're thinking about people who have no insurance, Judge Laurie mentioned resources at a center. Harris Health is another, resource. I have to mention that I work with Harris Health, so because it's smiling. But the difference is that the way these resources work is there is a thing called federal poverty level. Anybody wants to guess what is a federal poverty level? Federal poverty level is the income bracket at which the federal government thinks or feels that you can survive. So for one person, 2024 guideline for federal poverty level in Texas is how much? How much?
10,000?
You can survive in 10,000?
30,000.
15,490. So federal government feels that if you make 15,490, you can survive, you can have a house, you can live, and you can buy insurance. I don't know how, but that's the federal poverty level. So if you want to go to health center, you need to be at 100% of federal poverty level. So make either 15,490 or less. If you make over, they're going to charge you. If you make 150% of federal poverty level, which is about 22,000, you can get free care at Harris Health, which has 2 hospitals, LBJ and Bental, and 23 clinics. So it is a little more. Now, if you're 2 people, you keep adding roughly 5,000 to the second person, third person, fourth person, and that increases. But imagine, even if you are making money, that's not enough to. And in Texas, getting Medicaid is almost next to impossible. How do you get Medicaid in Texas? You can get Medicaid if you are pregnant. I would not suggest that route to anybody, by the way. Men cannot even suggest that. But still, it's not easy to get Medicaid in Texas. To get Medicaid, your income needs to be less than roughly 5,000. So there's no way you can survive with that. Texas is one of those states which did not qualify for Medicaid or did not get Medicaid expansion. So even the states which got Medicaid expansion are also thinking, did they continue or not? That's a separate issue. We're not talking about politics here. But Texas is not easy to get Medicaid. So healthcare is one of the worst, unfortunately, in Texas. And mental health care is one of the absolute worst in Texas, right? And another thing to remember is that when you see a therapist, when you see a psychiatrist, we love you so much that we want to see you almost every week, right? Which means that you need to ideally have insurance. Ideally, you should not be paying out of pocket because otherwise it can become costly, right? So insurance is the key. You can get Affordable Care Act or what they call Obamacare. Those can help, but some sort of insurance is needed for that. When you think about problems in Indo-Americans, of course you have depression, of course you have anxiety, of course you have all the problems which anybody could have. There is one set of complaints or issues which are prone to Southeast Asians more so than people here. What are those? Somatic issues. Somatic issues. And if you see a psychiatrist who has not seen those, for example, a psychiatrist who's not from our background or so, perhaps they may not be able to diagnose it that easily. So that's another reason culturally sensitive psychiatrist therapy is important, because somatic symptoms are extremely common in our culture, in our regions. And sometimes they are first or second or third diagnosis usually seen. So that's important. Suicide. If you think about the worst diagnosis in psychiatry, of course, what would be the worst diagnosis in psychiatry? Suicide is an end result, but what would be the worst diagnosis in psychiatry? Anorexia, eating disorders are pretty bad because they can result in complication. Schizophrenia is bad. Personality disorders are bad. There's a terminology called, SMI, which is severe mental illness. Certain illnesses are included in SMI, like schizophrenia or bipolar or depression. But other than that, no other illness is included in SMI, meaning they don't even get state funding for those illnesses. And people who treat those illnesses know how hard it is to treat them. So if somebody has OCD or PTSD or personality disorder, that's not qualified as SMI. That's another issue. If you think about suicide, Prashant mentioned homicide 24,000. The suicide data is about 49,000 in 2022. You will ask for the 23 or 24 numbers. The data about suicide is always about a couple of years lagging. So it's the latest numbers we have is 2022, 49,000. Out of the 49,000, if you think, 49,000 are the ones who completed suicide. Over 1 million tried. Over 5 million thought about it. And the way it works with suicide is that people think about suicide over 5 times than they complete. And the number one risk factor of suicide is what? Previous attempt. So if 49,000 people completed suicide in a given year, in 2022, there are so many people who tried but failed, luckily, thank God. Our job is to save those people, those close to 1 million people or 500,000 people from attempting again. If you and me, through this effort or any other effort, can save one life, we have done our job, right? So that is the most important thing we can think that. And how can you do that? How can you do that? In Desi culture, in our culture, I have attended, unfortunately, few funerals of young people where parents will say that this death is because of an accident. Sadly, and later come to find out, no, it was not. It was not. It was unfortunately a suicide. The parents didn't want to disclose that because they were ashamed. But when you go back and you think, there were warning signs, there were things which could have been. Of course, in hindsight, everything is very different. And no parent wants their child to suffer through that. It's very easy to say standing here. But what can we do as a society? What can we do as a culture and a society? A lot of times, if you think about it, there are few reasons common in all those cases. One, we put a lot of pressure on our kids. How many physicians, Desi physicians, do not want their kids to be physicians? Very few, right? But every child can do that. Then they want to do something else. So we have to put pressure just based on whatever they can take. And some kids can take it, and some cannot. Second, sometimes we put pressure in terms of marriages, that you have to do A, B, and C and marry according to our will or so. And that also puts a lot of pressure. And surprisingly, boys cannot take that pressure, girls can take more, but boys cannot. And all those suicides are mostly of boys. So just think about that also. Because these are really serious things and serious symptoms. Depression, very common, but we don't think about the symptoms. And one more thing, substance use, we try to minimize it. We think it's not common in our society or with us or so. It's the same in our society. Our kids go to the same schools as others. If you go to schools these days, which drug is the most common in schools these days? Actually, in schools, it's vaping right now. Yeah, in schools, if you're talking about schools. Marijuana is there, but it's becoming a little old-fashioned, I think. But vaping is there. But which drug, if you talk about adults, is the most common in history? Actually, not in history. I work in the ER, I see that. Houston used to be, of course, alcohol and marijuana is everywhere, right? But after those two, Houston used to be, as they say, the god of cocaine. But now cocaine has diminished and we see meth a lot. Lot of meth. Meth is, and the judges agreeing, a lot of meth. Fentanyl is picking up, but we see less of it because, thank God, we have triplicates, and every doctor has to see PMP and all of that, so there are some checks and balances, although it is picking up. But the number one is meth, then cocaine, and the others. Now, if you're in California, which one would be the number one? In California, it's actually LSD, because they like to fly high. So it's LSD. But here, that's the problem. And our kids are unfortunately getting into all of those problems. So that is an issue with them too. A couple of other things. We talked about a number to remember for resources. Judge gave the right number, but if you don't remember, just call 988 and they can connect you to anything. A couple of years ago, July 16th, that was the biggest victory for mental health, that we were able to establish one unique number for mental health. Just like 911, everybody remembers, 988 is the unique number for mental health. And I was looking at the website for REACH. It is on the website also. You have a very good website, by the way. So 988 is the easiest number to remember, and you can call that number, and they can. That doesn't mean that they will send police to your home, by the way. So that means that they can give you resources also. So that number is good for that also. Another website which is good is Mental Health America website that has resources, and perhaps you can get some resources from there and put it on your website. Prashant mentioned something important, which is about talking. I think the most important thing is that if somebody wants to do something for somebody else who is suffering, is to talk to them. Be a good listener, but don't be judgmental. Don't be a therapist to them. Don't be perhaps an advisor to them yet, because you need to just listen to them. You need to be in their shoes. So be a good listener. Talk to them, listen to them, feel them, and that's most important. People who don't talk to anybody, keep their feelings bundled up, get more depressed, and they are the ones who suffer more. Another thing is, we talked about suicide, and everybody thinks that suicide is always a result of psychiatric illness. Perhaps yes, but suicide is an act of impulsivity. Not every psychiatric patient is going to commit suicide. But yes, impulsive people commit suicide. So if you are impulsive and you have access to firearm, 54%, 55% suicides result because of a firearm. 20% or so because of suffocation. Overdoses are much less today than it used to be, maybe 9%, because the drugs are much more safer. So if you feel that you have somebody who's depressed, sad, anxious, and impulsive, and using substances, and you have firearms at home, you need to lock them, you need to take them away, you need to do something about it. Texas is open access. We cannot tell anybody not to carry firearms, but you need to at least protect them, because that will help not only you, but a future generation also. Another thing is that people worry about patients who have mental illness, and they feel that every mentally ill patient is violent. Only less than 5% of mentally ill patients are violent. Because if that's not the case, we all would be having 5 bodyguards outside our offices, and that's not the case, right? So only less than 5% of the patients who have mental illness are violent. So, in summary, what I would like to say is that please watch for warning signs, which could be somebody who's aloof, somebody who's withdrawn, somebody who's not taking care of things, somebody who's not enjoying things which they used to enjoy, somebody who is, if they were using alcohol before, maybe using more, using drugs more than before, their grades are falling. So something which is not normal, something which has changed. And if that is the case, they need attention. And don't think that attention means money. They can go and see somebody even if they don't have insurance. Resources are available. And of course, they can go and see somebody if they have money to. So both cases, they can. Also, don't feel that seeing a psychiatrist means that somebody is crazy. Even in our treatment, if you have become a psychiatrist, they usually say you need to have therapy of your own, you need to have analysis and things like that. So it's normal for people to have therapy, talk about things and all of that, because that's how you know yourself. So try to reduce the stigma, try to talk about these people, and special kudos to the young lady who came forward today. So thank you very much. Thank you. And if there are any questions, Thank you.
Thanks again, Dr. Shah, for an enlightening speech. And really, I'll take a moment to thank all the speakers. I haven't had to use my bell once yet. So that's well, it's really my pleasure to call upon a good friend now who really needs no introduction, Dr. Subodh Butcher. He's a highly respected physician. He's based in Sugar Land since 1992. He's board certified by the American Board of Pediatrics and the American Board of Family Practice. You know, he's an outstanding physician, but really, and he's been recognized by many appointments and awards, but really he's even a better citizen of our great community. He is known for his leadership, philanthropy, and dedication to community service. And as we all know, he hosts a weekly radio talk show called Open Forum. So he's no stranger to the microphone. Please welcome Dr. Butcher.
Thank you. It's always very hard to follow such a fantastic panel out here. Thank you so much for doing this. I want to thank Reach for actually, this is amazing. This place is packed, as we say in our comedy shows, standing room only. If you're not standing, you can stand, just to make that point. I want to introduce, thank you for that introduction, but I just want to lay down who I am and why I think I want to ask these questions that are going to come up. I was taking notes while you all were talking. I trained in pediatrics in New York, came to Texas Tech and did family practice. So I see children when they're born, and my oldest patient, God bless her, is about 107 years old and still ambulating. So you guys are amazing. But you know, the soldiers are really in the family practice offices. We are the ones who really get the brunt, if that's the right word, of cases, psychiatric cases. I know, I like the way you said, do not call that mental illness. I think that's a great way to help society. Let's change that word. When you need psychiatric help, we are the first ones who recognize and then take action. And in pediatrics, for example, we have mandates that ages 12 and above, you have to, you've got to give them a questionnaire, and they might fill it out, or the parents might fill it out, and we review it. And I'll tell you, many times we catch that just on those questions. Why? Because kids do not communicate with the parents. It's and that's because of our culture. In our culture, parents and children don't talk about mental illness. But that paper that we give them, PH29, as you are extremely knowledgeable about, catches a lot of these patients. And then Dina Gandhi is there, and I refer some patients to her and some to Prashant. And I'll tell you, we have saved so many youngsters just by doing that, just that little piece of paper. So that's why I call myself a little soldier. Just not because I'm short, just because we do the work out there. And we've seen, in my own practice, we see 35% of my practice is South Asian origin. And I see parents who were born in India, I see parents who were born here, and I see kids who were born in India, but they've come to Clemens High School or the middle schools, and I see kids who were born here. And it is a mixture, it's like a potpourri out there when we get into that room, and it is fascinating to see the dynamics. The parents have already made the diagnosis without even us talking to them. The parents have already told me what to do about the kid without actually me telling them what we should do about the children. So they're already, you know, we have these parameters that the parents come with. Now we are stuck. Now we are really trying to figure out how do we help this youngster and yet not make these parents really pissed off, because they do get mad. They walk away otherwise. It's challenging. And I think you talked about the income that the South Asians have, 130 or whatever it is. I'll tell you that may be a problem actually. become model minorities. And then every parent out there expects their child to be either a physician or an engineer or a lawyer. And that is, so no, with due respect, I'd love for her to become a lawyer. We need lawyers. But that is the expectation, and that really challenges these youngsters. I usually, in my practice, sir, I tell the parents to leave, even if these kids are 14, 15, and then I have a one-on-one, and they tell me, I don't want to be a doctor. I don't want to be a lawyer. I want to be a musician. But the parents will let them, or at least that's what they hear. So that's what I do, and I'd love to ask you all questions. I was told by Dr. Vani out here, you got 18 minutes. He knows why I told 18, because I always take 20% more than that. So I've got about 20 minutes? Okay, thank you. I would actually start with the judge first. Ma'am, thank you so much for coming here. And you guys run a tight ship out in your court. As you know, there's a shift of environment in Washington, and there's a movement to cut Medicaid. And just for everyone's knowledge, Medicaid recipients, the non-elderly but adult Medicaid recipients, what does that mean? Non-elderly, not above 65, adult above 18. So between 18 and 64 years of patients who are on Medicaid, 1/3 of them have mental illnesses. And they probably come into your court when Medicaid is going to be cut, if it is, by $800 billion with the B in the next 10 years. Ma'am, how are we going to face those challenges? Do you have any? Do we need a microphone there? Thank you.
I have one here. I'm not really sure.
Turn on.
Oh, okay. All right. Yeah, thank you for that question. A lot of where we are now in Harris County, the resources are provided through the county. So I think one of the speakers talked about, having the insurance as well, because I know that the Harris Center does partner with the insurance companies as well. If a person is not able to qualify for what's called the gold card, which would be that Medicare. So it will be an issue that a lot of people are concerned about. And I know the Texas legislature has just passed some new initiatives for funding, to increase the funding. So there's federal funding, and then there's state funding, and then of course there are private organizations such as nonprofits and so forth. So it'll require just collaboration. That's what I think, because mental illness is not, it's not going to just go away because there's not funding. There's going to be a need for everybody to figure out how can we.
Thank you. And I think the silver lining is the governor just announced 3 days ago that there's going to be an additional, it's probably minuscule, I think, $239 million that's going to be allocated for rural mental facilities. Not where you are, but in somewhere in Texas down there where it's needed, definitely. Thank you, ma'am. I'm going to go to my dear friend Prashant. And Prashant, the reason I'm going to ask you this question is I face this in my office all the time. Trying to get a patient into a psychiatrist is like trying to call Mr. Trump in the White House. Why is it? Is there, and maybe it's a double question that I want to ask you, are medical students not going to psychiatric residencies, or are there other reasons why it's difficult to get to see a psychiatrist or for us to refer?
Absolutely, a very good question, and really thank you, Subodh, for being the first line. I know all the primary care doctors are taking the brunt of treating mental illnesses. There is an epidemic of mental illnesses going on, as you guys are aware about. And, if you guys don't know, Subodh also does some stand-up comedies. I was expecting a joke with 107-year-old. Dil to bhi bacha hai ji. Going back to medical students, more and more are going into psychiatry now. I think 20 to 30% of each class is going into psychiatry. So we will see the number, but there is a shortage of generally healthcare providers in America today. There's a deficiency of doctors, and there's deficiency of psychiatry, no doubt about it. And I think with the prevalence going higher, it's getting harder and harder to get them in. But somebody like you shouldn't have a difficulty. You can text me or Dina anytime, and we'll be happy to take your clients.
That's a promise.
100%.
That's fantastic. Thank you so much. I'm going to ask Dr. Srivastava, actually the same question. Are the young graduates, are they not going to, as Dr. Shah said, the first line is probably the therapist. You know, he so rightly said, we don't want to use too many medications. We'd like these young people who need help to be seen by therapists. Is there a shortage of therapists? Because we face that also.
Well, I think one of the biggest issues is that people don't know where to turn, right? It's that access. That's a very big issue. You know, if we're in the South Asian community, right, we don't talk about mental health. We don't talk about issues. So, you know, if somebody needs help and support for themselves, for their child, they don't know where to go, right? And then you have all of these terms: psychologist, psychiatrist, counselor. You don't know the difference, right? So I think part of it is access, right? So that's why REACH is so great, because there's a directory, right? We know where to go, we know what to look for, and in all honesty, you're going to go to somebody that looks like you, right? That knows our culture. And I think that's a big thing, because when you don't have people that look like you, that you don't think is going to understand our culture, our family, our values, people are hesitant, right? So there are actually a number of therapists and mental health providers that are South Asian, but you have to look for them. You need to know where to look. And that number of psychologists is only increasing. That's why DOSA is a huge international division. It's a huge community of researchers only doing South Asian American mental health, providers, policy around it. So it's there, but if you don't know it's there, you don't know where to look. You know, the other thing is, you know, it is, again, kind of like I mentioned, talking about what your struggles is, connecting. You don't connect, you don't know where to look, and I think that is one of the biggest issues. And also, you know, like everybody else has mentioned, what are the indicator lights? What are the warning signs? You know, the old school belief is just dismissing it, right? Like, you know, just pray, just keep on doing what you're doing, it'll just go away, right? I think it's making space for that conversation, even within ourselves. It's that checking in that we often don't do. When do I need help? What do I need to do?
And just to extrapolate on that, women of Southeast origin will not go to anyone else unless there's a lady. So that's one barrier. Second barrier, then they have to speak the same language, and that is a big challenge. So to be honest, in our practices we have seen that a lot of women or men will actually have therapists in India. So you want to talk about that?
And vice versa. I actually see so many kids that are here and the parents are in India, actually. It really depends on the preferences and what their issues are. You know, if we're talking about first rounds for people in India, they might have preferences, but it does get less and less. But that again is why, why having that association of people is really important. Because again, what you're talking about, a woman seeing a woman or somebody going to see somebody in India, it's because they don't think that they can get culturally responsive care here. And that's what they need to know. You can find that where we live, right? And in all honesty, we live in the US, so even if you're a recent immigrant, somebody in India might not know everything you're going through, or the culture of stress, meaning the stress when you move to a different country, what that's like for you, because that's a very big indicator, like to things like domestic violence, increased stress. It takes the stress on the family, so it is important to find somebody in your own community as well, for just those reasons alone.
Thank you. And Ms. Anada, you are a brave lady, and we really appreciate you coming out. I know you've been on different other areas also, different platforms, and spoken about this, but this is the first time I've heard you, and you're very brave. What I'd like to know from you then is, you have come out and spoken about this. Have you had the opportunity then to teach other youngsters in schools or colleges or places of worship, etc., where you had an audience, a peer audience of your peers, and given them your experience and let them understand, because what you went through becomes something that you can teach others. You're not a psychologist or a psychiatrist. You actually went through this. Have you had that opportunity ever to do that?
While I was in high school, I was actually scared to tell my friends and my teachers what I was going through, so I never thought about sharing what I was going through to them. And the first time I actually spoke was at my graduation, so that was the first time my family...
Your graduation party?
Yeah.
The one you never invited me, that one? That one. So that's really brave that you, at the moment where you actually were the limelight of that party, you came out and spoke about it. I would hope that one day you will actually be the voice that these youngsters need. The kids that we see in our offices, they need someone like you to go to schools, go to colleges, go to temples, mosques, mandir, gurdwaras, and talk to them. And leaders of these institutions, colleges, schools, gurdwaras, temples, have to have those audiences. The youngsters, they don't have any problems, but they need to learn and understand how they can recognize, if at all. Thank you so much, and again, we're very proud of you. Dr. Asim Shah, I don't know what to ask you. You just said everything. You had a question? Dr. Shah? That's actually, coming from a radio talk show, I'm lost, at a loss of words now what to ask you. The only thing I would want you to tell us a little bit is about these new medications and the new treatment modalities that are available, that I think Prashant was also talking about, the TMS, etc. Just for the audience's knowledge.
Sure. First, I've listened to your program. I've called a few times also. And you do a very good program, by the way.
I want to give a shout out while we do that to my, where's Jagat Kamda?
Yes.
Jagat there is.
Shout out to both of you.
Thank you.
Shout out to both of you. On the way back from the emergency room, sometimes I turn in and tune in, and you both do a very good job. So
I think I remember your voice now. It's just wonderful.
It's a little husky voice, yes, you remember it. Second, you talked about family practice. So family practice residents do come to me for rotation. So I know. And 30-40% of family practice is psychiatry. Yes. And it's very important, as you can imagine. So they are the first line, and that's important. You were mentioning another thing about Medicaid, and I was writing some notes when you were talking. So Medicaid cut is not going to affect Texas because we never took any Medicaid expansion, so that's not going to even affect us. And lastly, in Texas, the governor allocated $2 billion for mental health, but the bulk of that money is going to kids. And some programs like TCHAT and CPAN, which is allocated to schools and consultations, and those are programs which schools should use to benefit some. And another thing you mentioned, that it's difficult to get in to see a psychiatrist. We have 50 psychiatrists in just our location. The wait time is between 1 to 2 weeks. And we take all insurances, there's no problem.
We shall take your card.
You can even call me and email me, that's not a problem. But the problem is that a lot of psychiatrists are into cash practice in big cities, which includes Houston, and that becomes a problem. You're talking about new medicines. Lately, the change has been towards novel medications, for example, esketamine, which is what Dr. Vajwani uses. It's very expensive, it's not easy to get from the insurance authorized, but I understand that Dr. Vajwani works with insurance and get authorized. TMS is there. But you know what? Still today, there is nothing like ECT, electroconvulsive therapy, which continues to be the gold standard and the best treatment if somebody is treatment refractory. People don't want to get ECT because of the stigma associated with that, and they think of one cuckoo's nest, that patients are shaking and all that.
Can you just tell what is ECT?
ECT is electroconvulsive shock treatment, which is, think about antidepressants. Antidepressants are 44 to 50% efficacious, which is not a lot of efficacy. but they're efficacious. Placebo is 33% efficacious. Esketamine is 65-70%. ECT is easily 70% efficacious. So the efficacy is way more than anything. Of course, it's a sort of an invasive procedure. You have to be at the local anesthesia, all of that. In Texas, you have to give consent. In Texas, you cannot drive back home, so you have to have a person accompanying you. But it is one of the best treatments, works very quickly, and you need to still continue to take your medications. It's a good treatment if that is the case. One more thing I would say, I don't have a young kid, otherwise I'll send them to you because you will be a very good pediatrician. So.
Well, thank you. I do, by the way, the disclaimer is I see newborn all the way up to
107, so I'm not
the prize. You get the prize.
So he's still marketing here. So.
Listen, I think that brings me to the end of my time. I didn't hear the bell, but I can hear it right here. Dr. Wani is a good friend of mine. He's really kind. He doesn't ring the bell when my time is over. But I want to, first of all, again, I want to go back and thank all of y'all. I don't know if you had a question. I know you had the mic.
I had a question, not an answer. I had an answer. The answer is you asked her a question. Is she going around places to establish what she is coming through and all that? So what we are going to do, that's why we have appointed her as an ambassador to the REACH. I just want to make it happen here.
And I think my time is up. Before they throw me out, I'm going to go back and sit down. Thank you very much. Again, thank you. You guys are amazing. Open Forum is going to actually host the entire board on the 29th. Jagat Bhai is saying 23rd is today. 29. Oh, we're going to do it in March. Next week, we're going to be hosting them. So come and listen to 103.5 FM. I did market myself.
Thank you so much, Subodh. You're always fun to listen to. So in ENT, we say cradle to grave. Because we're doing cranialectomies in newborns and then going all the way up to, centurions and treated. So, as far as aging. But thank you, Subodh.
Thank you.
Yes. Okay, now we're going to have one more speaker. His name is Dr. Ramasamy Lakshman. He did his residency in UK and in Chicago, and he's had 35 years in private practice. He sees depression and anxiety and uses a holistic approach with his patients. And he's sort of turned his practice into televisits now, and that's his niche. He's an avid hiker. He completes a half a marathon on a yearly basis. And REACH is honored to have Dr. Lakshman on their advisory board. So it'd be nice if you
thank you for including me in the. Okay. So thank you for including me in the advisory board. And I think it's a great organization, and we need this. I think the main problem with our community is a lot of they need need to educate them and awareness because a lot of stigma. So I've been doing telemedicine for the last 5 years, and I see different ethnic groups, and I would say in my practice, other than Caucasians, every other race they have a stigma. And Dr. Devika said mostly Indians, and that is true. Maybe Indians are worse, but Afro-American, Oriental, Chinese, Korea, all of them are hesitant to get the help. So I think this is an important organization. And then regarding, I want to say something. Regarding the numbers, I think you gave the suicide hotline number, but there's another important number. It's the National Mental Health Crises text number. If a patient is in distress, I give this number to them. And it's nationwide, and it is a text number 741-741. If you text this number, somebody is going to reply you and guide you through if you're in a crisis. It could be suicide, it could be anything, mental health crisis. And that's a number I think we need to put in the.
Sure.
And I see mostly anxiety and depression in my practice, And I'm seeing more and more anxiety disorders in my practice recently. And I ask them, what are you anxious about? Some of them say this world is not safe, and the politics, economy, all these things happening, they're worried about it in general. And regarding about stigma, one thing to get rid of stigma, come to us, telemedicine. You don't have to sit in a doctor's office. Nobody's going to see you. Talk to us. It's at your convenience. You don't have to commute, and it is not expensive. But only we see mild to moderate illnesses, not serious illnesses. And that's all I have said. Thanks.
Thanks again, Dr. Rushman. Please get your appreciation plaque.
Thank you, Dr. Lakshman. Thank you so much. I got a second opportunity.
Well, that does come to the end of our speakers. And again, congratulations to the founders of REACH for creating this organization and bringing it to light. I think the potential is just amazing as to what you can do. And certainly we are excited about hearing what are your future plans. And please address that for us.
Just before we do that, Dr. Wani, thank you very much for giving recognition. And since too many things, I would also like to give him a little introduction. Of course, you all know he is an accomplished ENT surgeon, or I should say, and what truly sets him apart is his fantastic work with Eternal Gandhi Museum. That is probably his legacy for himself, for Houston. Eternal Gandhi Museum is visited by people from the world. Definitely the only one of its kind in the US. And Dr. Wani was involved in every aspect of bringing Eternal Gandhi Museum to life. So you will agree with me that if Gandhiji was alive today, he would have been very proud of you as we are. So thank you, and it's an honor for REACH to recognize you. Thank you for coming forth so quickly once Albaji asked you to MC for us, an unknown organization. And you step forward and you've done a wonderful job. Thank you so much.
Thank you.
So here we are, and I had told you earlier, like, what we have done so far, what we're gonna do, and how you can reach us. After listening to all this magnificent and most learned and most above everyone speakers, I'm just feeling like how I'm gonna help the community with so many mental health challenges. But we have put down some program that we would like to share with you. So what I have done, what REACH has done so far is on April 6, 2024, we had one presentation called "Is Mental Health Stigmatized? Recognize and Recover?" That was done by Dr. Renu Thomas, and she's here. A beautiful presentation done by Dr. Renu Thomas. I think she just left, I believe. Oh, there she is. Please stand up. Thank you, Dr. Renu Thomas. And then we did one more presentation, because we think that South Asian young adults experience a lot of wide range of mental health challenges, but unfortunately cannot open up with the families. So we did one more presentation, Navigating Adolescence. Presenter was Ms. Bhavna Luthra. These both were done at Arya Samaj Houston, and they opened up their organization for us to start educating the community. Now, what we're gonna do in the future? So here we're gonna have plans for health fair booths. We will be also doing screening and assessment of mental health by giving them the survey in the communities. Workshop for professionals to manage stress and de-escalate the stress situation. We can bring MHFA, which stands for Mental Health First Aider course to someone, to the organization this course is very important. I have taken it. This helps people who's living with mental health challenge person. It helps you to understand how to talk, how to listen to them without being judgmental. And then also we're gonna have support groups depending upon the community's need. We're gonna bring support groups to the community. And one radio program we're gonna start very soon, maybe next month or so, and that will be To Fir Chai Ho Jaye. And this program will be addressing different mental health challenges, and our speakers and our advisors will be answering the question on the radio. With this, I just want to say that please open up your organization, the temples, and let us build, let us shake the hand together and build a better community, better healthier community, better understanding community. Thank you so much.
Good evening, everyone. Namaste. My name is Vibha Agarwal. Me, my husband Dinesh and I, we raised 3 children here in USA. So we all know how under pressure you can raise 3 beautiful children, how to cope with it. And that's the technique we want children to learn from us as a parent. So how to cope with the pressure, under pressure, how to take the failure as a first step to success. This is the reach. We want to reach to make mental illness, as rightfully say, that we're going to change the name. It might not be mental illness, it might be something else. For today, as this platform, I want to say mental illness because that's how we perceive. But that is the goal where we want to reach. Like rightfully says Doctor, that is our goal, I think, as a reach, to use another word for mental illness. Instead of mental illness, we can use another good name. So few things I want to, this is so important for me, I have to write, otherwise I can speak for hours without any writing. I'm honored to be speaking with you all tonight about a cause that is very close to my heart, mental health. Tonight, we gather to raise awareness and support for those affected by mental illness, and raise some funds because I'm a treasurer for REACH. So it's my duty to at least ask you guys to for the funds. But fund is not enough. For this mental illness fund, we need to do something more than just raising the funds. But to operate any organization, we do need some kind of funds. Let's break the stigma. Everybody still needs stigma. It is stigma when we as a parents always have in our head that log kya kahenge. This is the biggest challenge for as a parents having 3 children raising here, that worried about log kya kahenge. I think this is the stigma we want to cross. This is the first step we want to cross from help with the REACH and all the people sitting here helping us with too. Supporting mental health and create the support community. Mental health affects us all directly or indirectly. Many suffer in silence, afraid to seek help due to fear of judgmental reaction. It is indeed of our hour of us acknowledge the importance of mental health and take some action. By sharing our story and listening to others, we can create a safe space for help for healing and growth. Tonight, we have an opportunity to make the difference. Your donation will support vital mental health and services and education and research. But it is not just about the fund we raise. It's about the conversions we start. Let's pledge to listen without a judgment. We want to support without the conditions and to advocate the mental health awareness in our community. Thank you for being part of this journey. Together we can create a world where mental health is privatized and everyone has access to the support they need. Let's raise our voices, our funds, and our collective compassion to make the lasting impact on the mental health. Reach, we are here, and we are ready to provide the platform with you all. Thank you.
So as we were, can you all hear me? As we were making up the program, and we had some discussions on how to introduce our speakers and how to introduce ourselves, Rajanji reminded me very kindly, he says, everybody knows Alpha and I, we don't need an introduction, which of course left me with an inferiority complex right away. So I need you to boost my ego. I am Ranjana Bhagwa Bedi, and I come to Reach, and let me walk backwards as a retired teacher who has had 4 different professions, has been engaged in. Born in Kenya, went to school in Leeds, England, where I was one of the 3 Indian girls in a total of 50,000 students, just like University of Houston, University of in Austin. So personally, as many of you and our children are now experiencing, I have experienced the racial segregation, having been born, my husband and I were both born in Kenya, so in British Kenya, there was segregation. We were in Indian schools, Indian, Asian, American, African. Come to England, where again, and many of you can relate to this. Gender, as well as race. And come to America and get married in Canada and transition to US. And that is, the reason I'm saying this is many of our children now are experiencing intersection of many different layers of these, and we need to be sensitive to it, but we need to be proactive in reaching out to them. As was mentioned by our speakers, let us listen. So enough of that speech. On another tone, I did ask you to remember the word dosa. And I'm sure some of you have Googled it, and that was the whole idea. So what does DOSA stand for? I know you know. No idea? Well, it's very important, and it's really very something for us historians to be proud of. So, Dr. Zurasa, I'm going to give you the mic just for a minute, and I'm going to ask you to tell everybody about DOSA, what it is, and how you came to it, and how we at Reach will shamelessly leverage it to our advantage, and how we will ask you to partner with us.
So DOSA is the Division on South Asian Americans. It's actually part of the Asian American Psychological Association, but it is an international community of researchers, students, psychologists, therapists, policymakers, all concerned about South Asian American mental health. I actually organized our first ever international conference. All research, all practitioners, only South Asian mental health in our diaspora. It has a giant directory, but it's also, in all honesty, they're experts on South Asian American mental health in terms of the psychology world. Part of the, me creating the first ever South Asian American psychology book were with colleagues that were part of that community. Because even when you're in mental health, you don't know if there's another South Asian person or if the people doing research or providing care for us. This provides a platform where we can even find ourselves in the mental health world and connect and join directories like REACH, but also initiatives, programs around the country. So I think REACH would be a very good connection for them because there's so many people in Houston that are so disconnected, and this would be a great collaboration.
Thank you. So when we all started REACH, and I'd just like to introduce our founding members. Alpa is Alpa Shah, our president. I am the secretary. Public Relations Rajan, whom everybody knows. And Viva is our treasurer. Our newest director is Purushottam Sahu. And our two directors, two advisory board members are Dr. Lakshmanan and Dr. Gajwani. So we are very fortunate that as we struggle with just how to address the need in the Indo-American community, the good Lord intervened and brought Devika Srivastav to our door. But we had to persuade her. She did grill me on why we wanted to do REACH, etc. I guess she had some measure of faith, and she's put herself out there. And Dr. Asim Shah, who I also pursued quite shamelessly, and he's here too. So I encourage you all to be just maybe not as shameless, but please do spread the word about REACH. If each one of you here can reach out to 5 people, raise your hand, and you can do this, and 5 people, if you can tell 5 people about REACH, you can email us via info@reachmentalwellness.org. We will connect you anonymously. We can connect you to a variety of experts who can answer your queries. The experts have already told you our reason for existence is we are going to be culturally attuned. My sister, who was in need for many reasons, she said, and she's in England right now, often said, well, I go there, but they really don't understand my context because she's living at home with her son-in-law, etc. So please tell everybody you know to tell everybody they know about REACH. The reason, and Dr. Shah, we struggle with this too, is we wanted to know we were about mental health. And Alpa and I had this discussion about what word to use, and she often said, well, how are we going to talk about mental illness without using the word mental? So we will lean on our experts again to tell us how to do that. But thank you all these amazing speakers have been shining spotlight on all the various issues, and the rest is up to you. You've heard Alpaji's call to action as well. Thank you all for being here, and I will now pass it on to Rajan, the well-known Rajan.
Good evening, everyone, and this is the time for me to say thanks to everyone. And in this journey, we were discussing whether it's a stigma, or it is taboo, or it is wellness, or illness. Whatever it is in the journey today, you joined us this evening, a great sunny evening, and then the well-known Indian summer lunch is waiting for you. Shortly, it's a dinner. It's between a lunch and dinner, so it's 6 o'clock. So you can call it a dinner, early dinner. And before that, I want to thank some of these people who are behind the success of today's launch. If you feel this was successful, please put your hands together. Give a big round of applause for all these people. And to start with, I really want to thank all the public who are coming in spite of your busy schedule. You took time to join us at the 3 o'clock and then you're still sitting, it's already 6:40 something. Thank you so much for that, the public. And then next I would like to say the board, and I joined the board with them and put our hands together, the leadership of Alpasha, because she wanted to do a lot of things, and then finally we all decided to do this. We thought it's worthy a cause, and then we can do that. So Alpasha, thank you for joining us. And we also want to take this great opportunity to Dr. Asim Shah. Despite of so much commitments, he came inside. Actually, when he said he's going to be here for only 30 minutes, somehow it is so interesting for you, so you have stayed more than that. Thank you so much, sir. And please join us for the dinner. And in fact, I already packed the dinner for you. They said you're going to go, but now you can join us. Thank you so much for that. And then, of course, Devika Srivatso, we had a very good Zoom meeting with you, ma'am, and then fantastic. And then you were very inspiring speech. People loved it. And one more round of applause for these two great people. And other thing I really want to thank is Anaga Surendran for her courageous coming out. She has been our ambassador. So put your hands again together for the courageous act. And then father, who is with us, father, you know, he's a judge here. Honorable Judge, thank you so much for joining us. And then thank you so much. And Dr. Prashant, actually Prashant, when he came to meet us, he was came just like that. Within 10 minutes, he fell on the feet and said, "We are going to join your wagon." That's what he was. So thank you. And I really wanted to thank the judge who was sitting here talked about a lot of things, what's happening in Harris County and everywhere. And then thank you so much. And then our dear friend, Dosati, Dr. Subodh Butcher, he actually gave us time. We are going to go to the radio station and we're going to do a 1 hour show. Then we'll give the time, and will you be in a position to give us the time? Yeah, we'll give you the time, and then put your questions. We'll be answering the panel of this one. People will be sitting there. It's a 1 hour show. It's been graciously contributed by the Open Forum. All the gentlemen who are here. Thank you so much, Dr. Subodh, for doing that. It is May 29th at 5 p.m., 5 to 6 p.m. And we all meet, so we'll be there. But of course, we will not take any of your time. We'll give those time to the next week. Next Saturday. Coming Saturday. It's going to be next Saturday. And she's overwhelmed.
That means the dinner is today, right?
Dinner is tonight. And also we thank Dr. Lakshman for joining us today. And this particular evening is so beautifully scripted, choreographed, and put into a lovely action film by Dr. Manish Wani, because my language is always thank you. And then all my media friends who are all here and giving us all the support here. And I really want to thank Pata, who's been big supporter. You all know Pata. Pata has been taking care of the audio video tonight. And also, before I finish this, I really wanted to say something. I always want to thank one gentleman who's a very silent person behind all this success, and also one more lady there. Those two are Mr. Mahersha and Vijaya Rajan. Can you get up on that so that they know? These are people put together, and then they are, whatever time I come and do things, Vijaya tolerates all that. Same, of course, Mahesh is so well known to everyone, so it is nothing new about him. And I can give anybody I'm missing it, and all the directors are here, everybody is said. And then Mahesh, you want to say a word? 1 minute of your time? 2 minutes. 2 minutes is okay with it? 2 minutes.
Thank you. Congratulations to all the board members and the founders. You guys have done wonderful, wonderful job. Alpa has spent so much of time. We were in India and she will get up at night because of the time difference, and I'll get up also, and then I thought I'll be her first patient for the mental illness. No, besides joke, one segment that we did not address is the stress among young adults who are in the corporate world. We were in Bangalore just 2 months back, and then Bangalore is the hub for all the technological companies. And then we came across one young lady who must be in her 30s and just got married and had probably 1-year-old daughter. And she was working for QuickBooks, the Intuit. And then she was so burned out, so much stress and everything. She realized it, and luckily she talked to her husband, and then her husband advised that you talk to Intuit. So Intuit decided to send her away for 2 months. She came to the same retreat. She had a meditation and the yogas and everything. And then after that, she was literally in the depression. We sat there for almost 45 minutes and talked. So what I'm inferring is that look out for the people or children or the young adults who are in the corporate world, who are going through so much of stress, so much of competition, and working like 12 hours, 14 hours, 16 hours a day. Just look out for their burnout also and reach out to them, and please make sure they talk to you or they talk to us, to the panel. And then Rich is always there to help them. Yeah? Thank you so much. And again, congratulations and thank you so much for the wonderful audience here. Thank you.
One more thing, the entire show wouldn't have been possible without the support of these young kids. That is a really would like to thank on behalf of Nik Nikam and Erika, Jayashekara, Rohan Gill, Vikram Banga, and Avati just stepped out. She'll be joining soon. Please give a big round of applause to the students children who are coming here to volunteer. Thank you so much. And then please go and enjoy your breaks. I put you on a media person, but Dr. Nikam, just come here.
Oh, thank you.
Dr. Nikam is running a lovely show that's known as Citizen's Voice. So in that Citizen's Voice, he gave us a time last week, 30 minutes, where Alpaji was there and he was giving that. And he's a wonderful person and a very good friend of mine. But I'm very sorry, I put it on a media person. I'm very sorry. Dr. Nikam, one more thing.
When I take pictures, people say, why don't you take your picture? I said, every picture has my fingerprint.
You'll get caught one day. Thank you so much. If anyone I have missed, I'm very sorry.
Nina, the other radio program he was talking about.
Oh, Meena Darji, Meena Dar, everyone knows Meena Dar. And then, but Meena Darji, the problem with her is only if the program starts at 4, she comes at 8:45. Thank you so much.
She said she would be here at 6, and she was here at 6.
She supports everyone, such a lovely lady. Thank you so much. And we'll enjoy some more drinks are open. And in another 10 minutes, we walk out. There's a beautiful dinner set outside. Enjoy your evening. Thank you so much.